好像不是5:58而已吗？
我是听到每一个小时会跟我们讲啊。
等一下我把我的手机关一下。因为我Hello, good afternoon. Hello, good afternoon everyone. Good afternoon ladies and gentlemen. I'm Dr. Chua Sim. I'm a consultant physician, gastroenterology and hepatologist. I already have more than 20 years of experience in treating liver disease, and I'm on a medical doctor degree, a master degree in nutrition and health science, and also a PhD degree in biomedical informatics. I'm also an acupuncture doctor as well. So I'm not only I do speak English, Bahasa Malaysia, Mandarin, Hokkien, and Cantonese. So if you have any question, do not hesitate to leave us a message in any of the languages. And I'm glad to share my experience of liver disease with all of you today. And the topic I'm going to share with you for today is about our liver. Our liver is the largest internal organ in human body. It's located in the right upper quadrant of our body. Okay, they are contained of two lobes. One is the left lobe, which is in the middle of our body, and the right lobe located in our right upper quadrant area. It has few functions. The functions of the liver including it helps to remove the waste and harmful chemical from your blood. That means that it detoxifies some of the waste and the toxin in your blood. Second, it makes substance that helps digest food. So for the digestion, you will help to digest the food, and then it helps to fight infections. All of our blood will go through our liver, and then in our liver there are cells that can fight with the bacteria or virus in our body. So it helps to protect our body as well. Then the liver stores nutrients, vitamins, and hormones. And then of course it stores sugars. That is very important energy in our body. If you take too much sugar, too much calorie, then the sugar will turn into fat and accumulate in our liver, and we call it fatty liver. So fatty liver is a condition where extra fat accumulates in the liver. You can look at this is our normal liver, which is dark red in colors. If a lot of fat accumulate in our liver, it will become yellowish in color. These two pictures shows that the liver cells in our liver is under the microscopic. Okay, this is our healthy liver. You can see the pink color of the liver cells, and this dark dots is considered the nucleus in our cell. Is a healthy liver. So if there are a lot of fat accumulate in our liver, then you will see that there were ballooning cells in our liver cells. This is all the whitish ballooning cells is the fat accumulate in our liver cell. That's why your liver will accumulate a lot of fat, become yellowish in color, and of course it was swollen because too much fat occupied in your liver. So there are two types of fatty liver. One type, the first type, we call it alcohol-related fatty liver disease. It's related to our alcohol consumptions. The second one, we call it non-alcohol fatty liver disease. Short term, we call it NAFLD. There are two subtypes of non-alcohol fatty liver disease. One is only the fat accumulate in your liver. We call it simple steatosis. If too much fat accumulate in our liver, you become hepatitis, become inflamed. Then we call it non-alcoholic steatohepatitis. Short term, we call it NASH. So if a lot of fat accumulate in our liver, there are stages of the liver damage. You can see this is our healthy liver. It's dark red in colors. So if deposit of fat in our liver, we call it steatosis, and the liver will become enlarged in size. It is still reversible. If you cut down your fat in your liver, it can reverse, become a healthy liver. But if you keep having the fat in the liver will become inflamed, which is it will damage your normal tissue in your liver, and the cell will start having scar. That's why we call it steatohepatitis, we call it NASH. And if you're still under NASH, under steatohepatitis, it's still reversible. If you control your body weight and control your alcohol drinking, then you will reverse to become only steatosis, and you will still reversible to become a healthy liver. But if you still not under control, then you will have a lot of scarring tissue to replace your normal healthy tissue. This liver will become cirrhotic and you become hardened. That we call this liver cirrhosis. After your liver becomes cirrhosis, it already irreversible. It won't back to your steatohepatitis, it won't back to your normal cell anymore. That's why if your liver becomes cirrhosis, that means the whole liver will become cirrhosis. Not only that you have left lobe cirrhosis or the right lobe cirrhosis. So what you need to do is, before you go into the cirrhotic conditions, you have to go for treatment, control everything. You hope that your liver still can reverse to the steatosis or reverse to become a healthy liver. So the estimate of our Malaysians prevalence to have fatty liver is roughly 1/4 of Malaysian adults. It's almost 23% of Malaysian adults will suffer from fatty liver. So most of them, the higher cases when they are more than 45 years old, and then the higher cases among the male patient than the female patient. What are the symptoms of the fatty liver? Fatty liver often is a silent killer. So often there are no symptoms unless you go to have a check, have an examination. Otherwise you won't know that whether you have fatty liver or steatohepatitis or not. But if you already go into the liver cirrhosis, then you will start to have symptoms. For example, you have abdominal pain, uneasiness, loss of appetite, weight loss, or swelling of your leg, or jaundice. That means the discoloration of your skin or of your eyes. This is already an irreversible stage of the liver cirrhosis. So remember, the fatty liver normally is no have any symptom, is a silent killer. So what are the risk factors to have fatty liver? Mostly you are Asian people, you are higher, so easy to have fatty liver. So if you are obesity with a high level of belly fat, or you have high blood pressure, diabetic, or high cholesterol, or you have obstructive sleep apnea. What does it mean like obstructive sleep apnea? Obstructive sleep apnea is the blockage of your airway that causing breathing to stop and start again during sleep. So you'll find out the patient while they're sleeping, they'll snore and then they'll stop breathing and then you start back again. This is what we call it obstructive sleep apnea. And if you are postmenopause woman, if you're easy to have fatty liver. The reasons that these two conditions will have fatty liver is because these two kinds of patients, they will easily to have insulin resistant, which is the pre-diabetic condition. So if you have obstructive sleep apnea or postmenopause woman, we will suggest you to follow up. And then if you have excessive alcohol consumption, you are easy to have a fatty liver as well. So just now we say that obese patient, you're easy to have fatty liver. What about the slim people? Are they will not that they will not have fatty liver? Of course not, because there are few diseases that will related to fatty liver. For example, diabetic patients, high cholesterol patient, and hepatitis C patient. Although the patients are slim, but they still have the chance for them to have fatty liver. Then what about the obese patient? Does it mean that you will 100% to have fatty liver? Of course not. The answer is no. So if your fat is only accumulate in your belly, and not in your liver, then congratulations, you do not have fatty liver. So why that early detection matters? Because if you are still under the early stage, it's still fully reversible conditions. But if you've gone into the late stage, that means the cirrhotic stage, first of all, you are life-threatening, and then you will have a very high treatment cost to treat the fatty liver and the liver cirrhosis condition, which is not reversible. And then sometimes some patients even need liver transplantations. So if early detection is matter, then how are you going to check whether you have fatty liver? There are two easy ways to check your liver condition. One is do a routine blood test, the liver function test. The second one is to do an abdominal ultrasound. So the routine blood test, normally we will do the liver function test. It can pick up the steatohepatitis condition. That means that if you have a inflamed liver, you have hepatitis, then your blood test will show abnormal. What we see is the AST and ALT condition. If both of these markers higher than the normal range, this is the normal range. If the reading is higher than the normal range, that means that you have hepatitis conditions. You have to seek for treatment. And what about the GGT? If you are alcoholic related fatty liver, mostly the GGT will be higher, and it related to the amount that you've been taken. So what about the abdominal ultrasound? Abdominal ultrasound is a very cost effective because it's the cost is low and it's very safe, and then it's very easy to access. So it's a very good method for us to screen for fatty liver condition. A well-experienced doctor can get a lot of information from the abdominal ultrasound examination. For example, for the fatty liver wise, we can know about the grading of your fatty liver, whether if you are a mild fatty liver, moderate fatty liver, or severe fatty liver. Sometimes we can find out whether you have any fibrosis or any cirrhosis. Even a very small tumors that also can be screened by using the abdominal ultrasound machine. So what you need to do is to find a well-experienced doctor to check your liver and follow up regularly. So let us look at the image. That this is a normal liver conditions. You can see this is our liver, and then the liver start to bright in echogenicity compared with the kidney. This is our kidney. So you have a contrast with the kidney image. This we call it moderate fatty liver. And this is the severe fatty liver. How are you going to know that whether this is a severe fatty liver? You can see that the liver already become bright in echogenicity, and this is the vessels in the liver, and the margin of the vessel already blurred. That's why we call it severe fatty liver. So how are we going to prevent fatty liver? First of all, you have to avoid excessive alcohol consumption. So you have to measure your alcohol drinking. You have to lose weight. You have to comply to your medication. For example, your diabetic, cholesterol medications. And then you have to exercise regularly. It all helps to reduce your fatty liver. What does it mean, excessive alcohol consumption? For men, we recommend not more than 2 standard drinks per day or 140 grams of alcohol per week. And for women, we suggest not more than 1 standard drink per day or 70 grams of alcohol per week. What is the 1 unit represent? If you are taken 4% of alcohol beer, that means that 250 mils of beer recommend for 1 standard drinks. That means that women, you will not take more than 1 unit, 1 can of beer per day, and men, you not take more than 2 cans of beer per day. And the wine, if you're taken 13% of wine, that means that 76 mils of wine represent a 1 standard drinks. And if you are taken 40% of whiskey, that means that 25 mils of whiskey represent 1 standard drinks, and then 50 mils of the whiskey is represent 2 standard drinks per day. What about losing weight? If you can reduce 3 to 5% of your initial weight, it can improve steatohepatitis. Okay, if you reduce 10% of your initial weight, it can improve your inflammation. So that means that if you are 100 kg, your body weight is 100 kg, you have to lose 10 kg of your initial body weight, then you can improve your inflammation in your liver. So how are we going to lose our weight? First of all, you have to eat healthy. There are 2 very easy ways to measure your meals. One is the healthy plates method. We call it a quarter half method. That means that this is your plate. You take quarter of carbohydrates. For example, the rice and spaghetti, potatoes, meat, bihun, you take quarter. And then you take quarter of protein, including fish, meat. This is quarter of your protein. And then half plates of the vegetable and the fruits. And we will recommend you take more veggie than fruits. If you can't do the plate measurement, you can use your hand to measure your food. For example, if you take a meat, your meat have to the palm size is the meat that you need to take. For chicken wise, you can take a larger portion, and for fish wise, you can take larger portion. And the pasta and rice and potato, you take like this. This is your portions that you have to take. Of course, you have to take more vegetable. How are you going to measure your vegetable? You have to cup your hands, and then that's the vegetable you have to take for your meals. So what about the exercise wise? Exercise wise, we recommend you do a minimum of 30 minutes of aerobic exercise 5 to 7 days per week. You don't have to do marathon, but we will suggest you to do some aerobic exercise. We have 2 kinds of exercise. There is a lower impact aerobic exercise and the higher impact aerobic exercise. For example, the lower impact aerobic exercise, you can swim, cycling. You can use a elliptical trainer as for your exercise. You can walk, you can rowing, or you can use an upper body ergometer. This is the upper body ergometer you can use to do an aerobic exercise. And for the high impact aerobic exercise, we will suggest you to do running, jumping ropes, or you can do step aerobics. All these are aerobic exercise that you can do. Okay, what about the medication wise? There are two medication recommended in United States, but only one medication recommended in for Asian people. First one is the pioglitazone. It's a diabetic medication, but it's only recommended only in patients with pre-diabetic or diabetic patient for short-term use. Why is only recommended for short-term use? Because with the long-term use of pioglitazone, it might increase a bit of heart disease risk. That's why it's only recommended pioglitazone for a short-term use to treat the steatohepatitis patients. For the vitamin E, it's only recommended in United States, but there still is sufficient evidence in Asia, so it's not in our recommendation yet. We still need more evidence to get the result whether it's helpful in Asian patients or not. There's a lot of study shows that it might helpful, but it's still under study, so we are still waiting for the medications. For example, the diabetic medication, the SGLT2, the GLP-1 agonist, the liraglutide, it shows that they might have some benefit in treating fatty liver. But whether whether it can be used in the non-diabetic patient, we still need more evidence. And let us see, the Silymarin is the most popular medication to protect liver. The good thing is this medication, it has antioxidant, anti-inflammatory and anti-fibrosis effect. And then the side effect of the medication is very low. It's a very safe medication. But this medication, it can't remove the fat in your liver. You still need to use other method to remove the fat from your liver. So how are we going to treat the fatty liver? First of all, same, you have to avoid excessive alcohol consumption. You have to lose your weight if you are obese. You have to comply your medication, like the medication for diabetes, cholesterol, and you have to exercise regularly. If you can't comply with all above, first thing we will suggest you to decrease your fructose intake first. Okay, what is fructose? Fructose is the sugars, and the sugars in the fruits. So you might need to decrease your fructose consumption, because if you've taken a lot of fructose, it will convert to triglyceride and become fat in your liver. So if you can't do exercise, can't lose your weight, you just cut down your fructose as the first step to decrease your fatty liver. So that's my talk for today. The take-home message will be, fatty liver is a very common disease in Malaysia, and it is reversible in early stage. Provide prompt action is taken. It often has no symptoms. So you have to do some tests to see whether you have fatty liver disease or do you have steatohepatitis disease. Blood tests and ultrasound are very helpful in detecting fatty liver disease. And then improve in lifestyle can curb the disease. This is my talk for today. And then welcome everyone to have your question. So there is a few questions that brings up. Eating too much oily food can cause fatty liver or not? Eating too much oily food, compared with the sugar is even worse compared to the oily food. But if you've taken too much oily food, that means that sometimes you overeat. Your calorie will be too much calorie. So we will suggest you to cut down your oil in your food. Our body still needs some oil to maintain the functions. That's why you just don't take too much oily food. It still work. But most important is the fructose that happen. If your hepatitis antibody, does it mean that hepatitis B if you have hepatitis B antibody or hepatitis A antibody, that means that you have already protected from getting the hepatitis B and hepatitis A infection, but it doesn't mean that you won't have fatty liver. So what you need to do is you have to scan your liver and do the blood test. Then you only know whether you have fatty liver or not. Okay. Okay, this is regarding the infections in the liver. It shows that they will have pus in your liver. Fatty liver won't cause any pus in your liver. There's just some infection in your liver, then only you will have pus in your liver. It's not related to the fatty liver. Do you recommend Chinese medication for losing weight? There are Chinese medication that can help in control body weight, including the acupuncture. But what we will suggest that you don't take the Chinese herb that unknown origin, because all the medication that you've taken, they will gone through your liver to detoxify. That's why you will still consider as a toxin in your liver. If you really want to search the Chinese medication to treat to lose your weight, we will suggest you to see a well-experienced Chinese medicine doctors to get the medication and do the acupuncture. That's what I suggest. Okay, if losing weight unsuccessful, is surgery recommended? There are a lot of ways to lose your weight, including the nutrition counseling, exercise, gastric balloon, and then battery surgery. So every individual, every patient have their own special condition. So what I suggest that I will suggest you to go through a thorough examinations and discuss with your doctor, see which method is the best for you. For example, if you are a morbid obese patient, if you're a very obese patient, your operation risk will be higher. Sometimes we will try to put in a gastric balloon to cut down your body weight to temporarily cut down your body weight. Then after the perioperative risk in the decrease, then only will gone to the operation. So what you need to do, you have to see your doctors and get a thorough examination and discuss with your doctor which method is fit for you. Otherwise, you'll regain your body weight again after losing your weight. This is what my suggestions. Okay. Are all the body weight specialists doctor able to provide nutrition and healthy weight loss meals suggestion? There's if your doctors they have a nutrition's background, they will I think they will be able to give you the suggestion for you to cut down your body weight. What you need to do is just discuss with your doctor. If they are not able to provide the suggestion, they will refer you to see the dietitians in the hospital. Then they definitely can give you the good suggestions. What are the supplements for liver? The supplement, what we know that the supplement now is only the Slimarine. Just now I mentioned is only the Slimarine that as a supplement for liver. But just now I did say that it can protect you to have an antioxidant effect, anti-inflammation effect, and anti-fibrosis effect. But it won't remove the fat in your liver. That's why you still need to do something to remove the fat from your liver. So you can try the Slimarine to bring down the inflammation, but you have to do other things to remove the fat from your liver. If you are not able to do a lot of exercise, what will you recommend? Actually, walking is still a very good exercise. If you cannot do, if you have knee problem, then you can do some cycling. This is the good exercise you can take. But I would suggest if you can do walking, you have to do fast walking. Then you will be more helpful. So when go for blood donation, blood was rejected as tested hepatitis. But go for blood screening, the hepatitis A, B, C all are negative. May I know isn't something wrong with the liver? So mostly we will need to know what exactly the hepatitis the blood donation center detect. Whether it's the infection, not only the hepatitis A, B, C infection, but sometimes also with some virus, unknown virus infection like flu infections or other virus infection, we never know. So if they detected some infection, normally they wouldn't get, they would inform the donor and go to test for other tests. So you might need to do other tests that see whether you have other kind of infections or not. So the question is, obese middle-aged male, mild diabetics, non-alcoholic type, if found fatty liver by ultrasound but liver function is normal, so it's not serious, whether it's true or not. That's what we say is under a statosis conditions. So what we suggest, you have to put down your body weight. Sometimes will help to control your diabetes as well. And then before it become hepatitis, you put down a bit your body weight, it might helpful. So we'll suggest you to cut down your body weight. Is very important. What I would suggest, you cut down your fructose consumption first. They will be very helpful, not only to control your body weight, to decrease your fatty liver, but also it helpful in your diabetic control. So now the silymarin is still a supplement for liver health. What I say that it had antioxidant, anti-fibrosis, and anti-inflammation effect. This another question is, every night when they sleep they have a bitter taste in the mouth, whether it is the liver disease. Is not, if it's not related to the liver disease. So whether you have liver disease, mostly it will be silent, no symptom. That's why we will suggest to do a blood test and the ultrasound examinations. So whether 牛樟芝 is a Chinese medicine, is as a good as a liver supplement, we need to follow up, because with the supplement sometimes it helps in liver, but sometimes it's toxic in liver as well. It depends on the dosage and how you use the Chinese medicine. So for the Chinese medicines, when you're taken, normally we'll suggest you to follow up with your Chinese medicine doctors, and then follow up your liver function regularly. That's my suggestions. Does omega-3 reduce fatty liver risk? No. Omega-3 is considered is a good oil, but it's still oil. So if you're already obese and taken a lot of oil, we wouldn't suggest to take omega-3. It won't reduce your fatty liver. Until now, it's only the diabetic medication pioglitazone can reduce the fatty liver conditions, but not the omega-3. But of course, omega-3 is a good effect in the heart disease, bring down the inflammations, but it cannot reduce fatty liver in your liver. There's a lot of weight loss medication from the company. So but there are different way of different mechanism. So what you need to do is to discuss with your doctor which one is best for you to take, and how are you going to treat your body weight conditions. So how do we know that doctors are well experienced enough to use abdominal ultrasound and judge the abdominal ultrasound image? For my case, I'm well trained in abdominal ultrasound, and I'm treating and follow up my patient regularly for more than 20 years. That's why I know how to interpret the ultrasound image and let my patients know how's the progressions. That's why. How are you going to know whether this doctor is well experienced? Maybe you can get more to know your doctors, then it might help. Okay, that's our talk for today. Thank you for all of you to join us in our talk. Hope all of us will have a happy liver and healthy liver. Thank you.